This is one of the pages generated from the Dexa scan data. The Dexa scanner calculates your body composition by passing a very low level X-ray of two different wavelengths through you towards the detector which is under the table that you lie on. How much of that X-ray of each wavelength that gets through to the detector in each pixel of you is determined by the overall density of you in that pixel. So because we know the standard density of bone and of fat and of lean tissue, we can therefore calculate the relative amounts of all three tissue types in that particular pixel. The pixels are then all added up, and that's how your body composition is calculated. The results are expressed in kilograms of fat, lean tissue and bone, and those three components all add up to equal your overall weight. This is the scan image generated from a 46-year-old female where the three tissue types are shown in different colors. Blue is bone, red is lean tissue, and yellow is fat. Actually, the colors are represented on a continuum. So where the color is pure yellow, for example, on her hips, that means that it's just fat that we're seeing. There's no other tissue in the picture. Bear in mind that this is a 2D representation. She still has fat on her abdomen and her bottom and the front of her thighs, for example, but she has muscle underneath, and so the color becomes a combination of the yellow and the red, which is represented here on the continuum. You can see that this lady is carrying most of her fat on her hips, which most females do, and in fact you can also see that probably 80% of her fat is held below her waist. So very little on the upper body, and the vast majority of her excess fat is on her hips and legs. This is genetically determined for her, and it's not possible to simply target the lower body. You can't spot reduce. All she can focus on is losing fat per se, and it comes off where it comes off. Having said that, if she manages to lose fat, it most likely will come off the extremities first, so lower legs before upper legs before central areas. Hips, even for males, more so for females, tend to be the last place that fat will ever come off, with the abdomen the second last place. So the image really just shows you where the fat is for you, and as I've said before, there really is nothing specific that you can do to change this distribution. It's just you. However, knowing that you have significant fat on your extremities does, I suppose, forewarn you that should you start to lose fat from this point on, you may need to be a little bit patient in terms of expecting your problem areas, in this case the hips, to start shrinking immediately. The appendicular or extremity fat needs to be somewhat depleted before the central regions really start to move significantly. You can see from this scan that this lady has significant excess fat on her inside thighs and also even her calves, and so I would anticipate that as she starts to lose fat, initially most, but not all, of it will come off these areas, and only after these areas are mostly depleted will fat start to come predominantly off the central areas, so in her case, her hips. Although looking at the image and seeing where you store your fat is really of academic interest only, that is, it doesn't directly give you any specific information to help in the process of losing fat. It does, though, give some people a bit of a reality check, certainly as to the extent of the amount of fat that they hold, and this can, in a lot of cases, serve to motivate change to do something about it. Now, this is a 41-year-old male who, in contrast to the previous client, holds most of his fat centrally. there really is very little excess fat on the arms and legs. Centrally located fat is an independent risk factor for cardiovascular disease, that is heart attack and stroke. At 41, this man really needs to lose a lot of fat, not just for appearance reasons, but for health reasons. Whilst he's well aware that he's overweight, the Dexa scan has still given him a bit of a reality check. He's carrying approximately 35 kilograms of fat and really needs to lose at least 17 kilograms to get to a healthy level for him. Ideally, he should lose about 20 kilograms of fat. Just to give a bit of an idea as to how lean it's possible to get, we'll have a look at two more scan images. This first one is a 32-year-old male who carries 11.7 kilograms of fat at the time of this scan. As you can see, it's difficult to really see any yellow on the scan image at all, maybe a skerrick on the top of the hips. It should be noted that this person was 30 kilograms heavier a few years before this scan was taken. Presumably most or all of that was fat. So that's quite a remarkable effort. Similarly, this is a 55-year-old lady who carries 11.4 kilograms of fat currently. You'll note that we can still clearly see fat on the hips and thighs, but very little elsewhere. This is normal and still consistent with being very lean. At 55, this lady is in excellent shape, and you'll also note she has good muscle mass. I know she does weight training as well as closely controlling her food intake. So that's just a bit of an overview of the images that are generated from the Dexa scan. The images serve to, I guess, visually confront those that are overweight, and in some cases give a bit of a reality check. And it tends to drive the motivation to do what needs to be done to get lean.